Good afternoon, my name is Michael Sachs. I'm an RCP student here at Parkville College, and this is my MDI Competency video. Before I enter the patient's room, I'm going to review the patient's chart and verify the physician's orders and see if there's any thing I need to be aware of, like allergies or anything else that might be important. Also, when I walk in, I'm going to be immediately assessing the patient for physical signs, skin signs, color, level of difficulty of breathing. All right, so before I go in, I'm going to gather up all my stuff. Got a peak flow meter, saturation meter, medication, and spacer.
Come in.
Good morning, how are you today?
Fine.
Good.
I've been better though.
You've been better. Well, I'm here to try and make it better for you. My name is Michael. I'm from respiratory, and I've got some doctor's orders here to give you an albuterol treatment.
All right.
Okay, so let me just get myself all sanitized here for you. How long have you been feeling like this?
About 3 days ago, I was kind of exercising. I was having a lot of trouble breathing. I decided to come to the emergency room, and they wouldn't let me go home right after.
Oh, okay. The doctors prescribed for you albuterol, which is a bronchodilator. So what's happening right now is your bronchioles are a little tight, and the medication is going to help loosen those up for you. So before we get started, if I can get your name.
Chet Beadle.
Chet Beadle, all right. And your date of birth.
November 3rd, 1963.
Okay, very good. Just going to match it up all against your wristband here. Fantastic. Okay, so before we get started, I'd like to take some vital signs.
All right.
All right. We'll start off with blood pressure. There we go. Fantastic. All right, I'm going to inflate this, and you're going to feel a little pressure, but it shouldn't be too uncomfortable. It only lasts for the first few seconds.
Nurses are doing this every couple of hours. Waking me up at night.
Very good. Next, I want to take your heart rate. So, okay. And while I'm checking the heart rate, I'm also going to be checking the respirations for the patient. And while I'm also doing that, I'm going to put the pulse oximeter on the patient and check oxygen saturation. Okay. Okay, for expediency's time, I've actually checked his pulse for 30 seconds and checked his respiratory rate for 30 seconds. And I'm going to notate on his chart here that his heart rate was 76 and his respirations were 18. Looking at the pulse oximeter, his oxygenation saturation is at 94. Okay, and is it okay if I listen to your lungs?
Oh, yes.
Fantastic. All right, so before we do that, I'm going to make sure we get it nice and warm for you. How you feeling right now?
Yeah, okay.
You're okay?
Yeah,
All right.
not too bad.
All right, very good. Okay. So if you could take a deep breath for me. Excellent. One more time. And again. And one more time. Once more. And again. Okay, I'm going to get you around here on the side. One more time, please. Okay. Get you on this side. All right. Check in the front. Deep breath. Another deep breath. Okay, one more time. And again. All right, and one more time, please. Very good. Well, I can tell you definitely have a little wheezing going on there, so I can understand why you might be having some difficulty breathing. So one of the things that we like to do before we actually give a treatment is finish off with our baseline assessment, and one of the ways we do that is with the peak flow meter. So I brought my own, and I'm just going to show you how it's used real quickly, and then I'm going to give you yours, and you'll be able to keep yours. You can see it's got some markers on here, and a little red marker here, and when you blow into it as hard as you can, kind of like blowing out birthday candles, it'll push that red marker up there, and then we'll take these little ones and move it up there. We'll do it 3 times. Be sure not to cough into it or put your tongue on it. And so we'll do it 3 times, and we'll take the best number from that. All right? So basically, you just put it to your mouth, take a deep breath, and see, I'm not in any respiratory distress, and I'm all the way up here. So I would take the little marker, move it up there, and do it 2 more times. And so I'm going to have you do the same thing. All right. So this is yours. Move the markers down all the way to the bottom. There we go. So I want you to go ahead and I can take this off your finger right now. There you go. Go ahead and take a deep breath, and then blow hard, once as hard as you can. All right. Okay. All right. One more time for me, please. Okay. All right. And one more time. Great. Okay. All right. So you're blowing at 4:15. Okay. And you're probably wondering, what does that mean to me, right? Well, inside your little peak flow meter package is a little chart. Let me get this out here for you. I'll show this to you. So, chart has normal ranges based on your age and your height, and based on your age and your height, you should be at 593. Okay. So you're definitely a little bit of respiratory distress, but we're gonna kind of try and treat that.
So that's why it feels a little tight in here.
Exactly. Right now your bronchioles are a little tight, and we're going to give you some medication that's going to expand the bronchioles. All right. All right. So, I don't know if you notice on the back here the chart. So every day when you do this and you take your medication, you can actually chart this and see your progress and see.
So I have to do this at home?
Yeah, you can do this at home, just the same way you did right here. Just
Okay.
it's got days and time, and you just chart it before you do the medication. Take the medication.
Okay.
All right. So now we're going to do the treatment. So this is albuterol. Okay, albuterol again is a bronchodilator, and you're going to give to yourself what they call a metered dose inhaler. Pretty self-explanatory. It's a metered dose, and you're inhaling it. This is the medication. Real important that you warm it up. If it's too cold, you're not going to get the right amount of medication in your lungs the way you want it to. All right, so what you're doing is you can either hold it in your hand like this, you can roll it in your hand. This is also kind of a good way to do it because you can you get to mix the medication up in here, especially for the first time you're using it. Or you can give it a little shake. Why don't you do that for me here? Show me how that's done. Look, so you're already an expert. All right, so you're gonna take the medication, you're gonna put it in the delivery device, and it should just sit and stop right in there, okay? So there's a cover, this keeps lint out of it, so you got this thing in your pocket, last thing you wanna do is get lint on the inside, but just to be safe, what you do is just kind of blow out on it a little bit. There you go. Make sure there's nothing in it, really, okay. All right, so not only is this your daily medication, but this also can be used as a rescue inhaler. So keep this with you at all times. You're feeling that you really are having coming on an asthma attack, you can feel free to use this, even though it may not be your scheduled time. But you want to note that here, because when you come back to see your physician, they can see that you're having to use it maybe more often than you should, and they may want to make some alterations to your medication.
Okay.
Okay, so I don't know if you've ever used breath spray before.
Yeah, Banaka.
Banaka, yeah. So I remember the Banaka Blast.
Oh, yeah.
Remember how it feels when it blows on the back of your throat?
Cool, refreshing.
Well, that's great for when you're trying to, make your breath nice. But when it comes to putting medication down your lungs, you don't want that. So this little device here is called a holding chamber or a spacer, and what it does, it holds the medication in here and allows you to inhale the medication without it blasting the back of your throat, and that way you get more of the medication in your lungs.
Okay. Sounds simple.
Okay, so it's actually very simple to use. You can see one end kind of fits into the other real simply. Okay, and take the cover off here and make sure it's clean as well. So the way you want to use this is you're going to want to put it up to your lips and tilt your head back and squirt it into the chamber. But before you do that, just almost forgot to tell you, especially with a new medication, you want to what they call prime it. And so you're just going to want to give it one good blast out in the middle of the air. See it coming out like that?
Yeah, actually.
All right. So now it's ready to go. All right. Well, let's go back to putting it back together again and administering this to you, where it's going to do some help for you. All right. Just pop that little guy in there. Why don't you take that from me, and you're going to put it to your lips. Tilt your head back. Just go ahead and activate the canister, and it's going to put the medication in there. Now I want you to take one big, long, slow, deep breath. Now you hear it whistling, you're actually breathing in a little too fast. Without the whistle, perfect. All right, now hold your breath for 10 seconds. And you can use your fingers to do it. It's a good way to do it. All right, and when you exhale, I want you to exhale through your nose. Excellent. How do you feel?
A little lightheaded.
A little lightheaded? Well, that's to be expected. Actually, very, very common with this medication. You could feel a little lightheaded. You could actually have some tremors, and perhaps and your heart rate is probably going to go up a little bit. But that's normal. If feels like it's racing too fast, feel free to call your doctor, or if you can't get a hold of your doctor, feel free to call 911, because it's better to be safe than sorry. Okay. So this medication usually takes about 3 to 5 minutes to actually start working, although you are starting to feel the effects a little bit, I'm sure. All right, so what I'm going to do is I'm going to check your pulse rate again one more time, because you did say it was increasing. There we go. And just want to make sure it's not increasing too much. Okay, yeah, it's a little faster, but it's within reasonable limits.
Stuff's making you cough.
That's to be expected. What we're going to do is we're going to do one more puff, because doctor says you want to do 2 puffs 4 times daily, and so your treatment's not quite over yet.
Okay.
All right, so we do it one more time.
So,
And show me how you do it. There you go.
so up.
Yeah. There you go. Long, slow, deep breath. Excellent. Hold it for 10 seconds. All right. So we just got another couple minutes before we're gonna reassess you here and retake those vitals and see how this is working for you. So in the meantime, let's talk about what to do with this when you do have it at home.
Okay.
So after you're done with it, you go ahead and you can take it apart. Make sure you put the cap back on, because again, you don't want to get lint or anything in there. Again, keep this with you at all times, because you can always use it if you really need to. If you don't have the spacer available, you can always use a toilet paper roll, or you can hold it away from your mouth a couple inches.
Oh, okay. That's
You know,
good.
they'll kind of keep it from blowing back in the back of your throat. But if you don't have either of those things and you're in distress, please, just use it. Take it the same way we did before, but without the spacer, into your mouth, and breathe in long, slow, and deep, and hold it in there. And the reason you want to do that and hold it in there is it gives a chance for the medication to get all the way down into your lungs and get some work
Well,
done.
what does the spacer do for me?
So
Because
again,
that seems inconvenient to carry around.
it does, but it actually helps more of the drug get into your lungs better, and instead of in the back of your throat.
Oh, okay.
And that's really important. You're going to find that you're going to want to clean this as well as your delivery device, and you can just take the medication back out again. Take this out. You can soak this in warm soapy water. Distilled water is best, and you can rinse it in distilled water, and then you want to let it air dry. It's really important to let it air dry and not use a rag or a towel or anything like that, because that would create static, and then that would make the medication stick to the inside of the device instead of going in your lungs.
Oh, okay.
All right? And you do the same thing with the spacer device as well. You can take this all apart, soak it in warm soapy water for 10 minutes, and then rinse it with distilled water, and then let it air dry again. And if it starts to get really yucky, by all means, call your doctor. I'm sure they'll get you another one. You can get these at any pharmacy. All right? So now the medication should be taking effect.
Actually, I do feel a little better.
Okay, good. So we're going to go ahead and reassess your vitals. I'll put this back on your finger again, okay? And I'm also going to take your blood pressure. All right. Well, I'm glad you're feeling better already. It's nice to know the medication seems to be working. We're just going to verify that now with vitals, and we're going to do the peak flow meter again. All right. Okay. BP is 134/86, increased slightly, but that's not to be unexpected after taking the medication. Let me check your heart rate now. Let's take a pulse. So for expediency of the video, I am taking the pulse for 30 seconds, and without letting the patient know, I'll be assessing his respiratory rate and noting that down as well the following 30 seconds. So based on those findings, your heart rate has increased to 80, and your respiratory rate is actually still 18. All right, and your pulse ox is 98, went up from 94 to 98.
Wow.
So
That's not
you're oxygenating better. You should be feeling better.
I am, yeah, a little bit.
Okay, great. So one thing I want to have you do is I want you to have you cough for me into this paper towel. So to do a proper cough, I want you to take a nice deep breath, hold this up to your mouth, and cough really hard into it. All right, very good. So assessing the patient's cough, I'm not seeing anything in here. If I did see anything, I would assess for color, texture, and smell. In this case, there was nothing. Now, also want to listen to your lungs one more time. All right, you lean forward for me a little bit. Okay, take a deep breath. Okay, take another deep breath. One more time. Okay, another deep breath. And again. One more time. Get you around the side here. One more time. Okay. One more time. Again. One more time. Again. All right. And one more time. It sounds like the wheezing has subsided a little bit. I can still kind of hear it a little bit, but it sounds a lot better than it did before. Okay, so, do you have any questions for me right now?
Actually, yeah, I get to take all this good stuff home?
Yeah, this is all yours. Well, they're going to give you a nice bag to take everything home with.
Okay.
So put this back together again for you.
And that,
And the peak flow meter, well, yeah, that's the final piece de la resistance. Okay. So this is actually going to really tell how well your bronchioles have opened up. All right. So we're going to do this again 3 more times.
okay.
Same way that we did before. Move the little knobs down there.
This stuff makes me want to cough.
Yeah, it's supposed to do that. Okay. All right. One more time, please. Okay. Looks like it's there's already been an improvement here. Let's try it one more time. Okay. Best value out of here is 515. Okay. So, way to know whether or not this is really working is you want to see how much of a percentage it's improved.
Okay.
And so what I'm going to do is I'll use this little board back behind me just so you can see what I'm doing.
Do I have to do higher math now?
No, but when we look at your charts, we'll be able to do that. But this way, at least you know what we're doing here. So you started off with 415, and you finished off with 515. So the difference in that is 100. Okay, and you're going to take the 100 and divide that by the original amount, and this will tell you the amount percentage that it improved. Grab my calculator here. And that is 24%.
I was guessing a little less than 25.
Yeah, pretty close. You almost could do that one in your head, couldn't you? Yeah, so anything over 20% shows that the medication is doing what it's supposed to do.
Oh, okay.
Okay, so if you have any questions for me, I'd be more than happy to answer them for you.
No, I think I'm doing fine.
Okay, and well, it looks like you're feeling better.
Yeah, actually I am.
All right, so you're breathing a lot easier. Okay, fantastic. Well, it was a pleasure meeting you. I am going to pass all this good information to the physician, and he'll be in contact with you to follow up.
Okay.
Okay, my stuff here. Hope you feel better.
Thank you.
Good to see you.
Thank you, thank you.
Gather my stuff. Probably don't want this.